Hello, students interested in the dental assisting program at the Moreno Valley College. We are so glad you were able to join us today virtually and finding out more information about our program. My name is Dr. Lydia Holshoff. I am the program director for the Moreno Valley College Dental Assistant Program. And I am joined today by Ms. Catherine Laren, who is the full-time faculty member here in our program. Ms. Laren?
Hi, everyone. Welcome to our virtual meeting. My name is Catherine Laren, and I am a full-time faculty here at the Dental Assistant Program at Moreno Valley College, and we're excited to meet everyone.
And we're also hoping to be joined soon by Natalie Valcarcel, who is the administrative assistant for our program. You will likely talk to her on the phone if you have any questions, and she will be the one taking in your application when you come by to drop off your application, if you choose to do so. Today, we would like to give you some information about the program, and if you have additional questions, please feel free to click on the button for additional information requested and send us a quick note. We will get your question in the mail. You can leave us a contact phone number or a contact email where we can reach back to you to give you this additional information. Also, you can schedule a tour if you would like to see our campus and our facilities, and you can do this tour scheduling using the same procedure by sending us a quick email. So we're going to begin this presentation by talking about what a dental assistant is. And a dental assistant is really the glue that holds the dental office together. The assistant is a very important part of the dental team. You can work as a dental assistant with a certificate or degree. So once you graduate from our program, you would get your certificate, or you can get your degree in dental assisting, associate's degree in dental assisting. And you can sit for the registered dental assistant exam. This is an exam that's administered by the state of California, by the dental board in California. As an RDA, or a registered dental assistant, after you pass this board administered exam, you are allowed to perform additional duties that you cannot perform as a dental assistant. But the RDA certificate is not necessary for you to find employment. So you can either work as a dental assistant or as a registered dental assistant. And we encourage all our students to sit for the RDA exam. We prepare the students, they're well prepared to pass this examination and obtain their licensure, and therefore be able to earn, to increase their earning potential. You can also obtain specialty certificates in ortho and oral surgery. These require additional training and additional exams, again, administered by the Dental Board of California. Our school has the recognition from the dental board. Our program has the registered dental assistant program recognition, and because we do have that recognition, you are eligible to sit for the RDA exam. Not all the programs have this recognition, but again, you can obtain employment without the RDA licensure. We do encourage everybody to get that licensure.
So let's talk about what a dental assistant is. So a dental assistant is someone who will work alongside with the dentist, doing procedures such as chairside assisting, and some of those procedures include root canals, crowns, even extractions. Other duties may be doing front desk duties such as billing, scheduling appointments, maybe greeting the patients as they come in the office, communicating with the back office when the patients arrive or when there's any changes to the schedule, and maybe doing purchasing and ordering of supplies for the office. Some other duties can include reviewing medical history and then reviewing that medical history with the patient, then with the dentist as they come into the operatory, doing x-rays on the patient. You're going to work directly with the dentist chairside, and you're also going to be in charge of infection control of the operatory and maybe even the sterilization, and then also maybe taking impressions. So those are just some of the duties that you'll be responsible for.
So as you can see from this long list that you've just heard about, the role of a dental assistant in an office is varies, and there's a lot of diversity in the things that you do. Therefore, the job is not boring. It's never boring. There's always something new, something different. You interact a lot with the patient. So if you are a people's person, this is definitely for you. So it's never boring, very interesting.
So some of the other chairside duties include seating and prepping for patients. So you would prep the room, make sure it's set up and ready for the dentist. You would go to the front office, greet the patient, walk them back, and get them ready for the dentist before they come into the operatory. Charting either for the dentist or the dental hygienist. Instituting infection control procedures, and that could include keeping up with what the new procedures are with OSHA, having a logbook, maybe training your faculty, your staff, mixing and passing dental materials to the dentist, assisting the dentist during procedures. Some of those procedures we talked about: root canals, crowns, extractions, and there's many, many more. Ensuring patient comfort, so making sure you're talking to your patient, asking them how they're doing, how they're feeling, what are their concerns, answering their questions, and then exposing and processing radiographs. And then as far as the front office, billing is one of the duties, scheduling appointments, prepping patient charts, ordering supplies, and answering the phone. And at the Moreno Valley Dental Assisting Program, we train you for both front office and back office. We want to make sure that you can do both and that you're cross-trained, because even if you are hired, say for a back office or front office, if you know the other duties, then you're more hireable. The doctor will like that you can just step in if someone maybe calls in sick, or they need someone to cover either the front or the back.
So definitely this profession requires somebody who has compassion for the patient and can multitask. And these are skills that will make you very employable. So as part of this presentation, we need to let all the interested students know that as working in the dental field, just like in any other medical field in general, you may be called to work with patients that have bloodborne pathogens. They may have things like hepatitis B, C, D, or the HIV virus. But as dental professionals, we treat everybody with respect and everybody the same way. We teach our students how to use standard precautions so that everybody is safe. You are safe, the patient is safe, but professionals do not refuse treatment of a patient based on what they put on their medical history. But we are required to let you know that as a healthcare professional in the dental field, you may be exposed to such pathogens, and as we mentioned before. Also, we need to let everybody know that as part of the RDA exam, the state of California requires all the candidates that apply for that exam to have fingerprinting and background checks done. And based on the findings, they may or may not issue you a license. So we need to let everybody know this ahead of time also, because our students are in externships and working with different drugs and medications and minors and people under general anesthesia. We are requiring all our students to have a background check and drug testing prior to being admitted into the program. All that information will be given to the applicants as they receive the acceptance letter in the program.
So some general information about the program. We began in the fall of 2006. Classes are held on the Moreno Valley College campus, but there are externship rotations at Loma Linda University School of Dentistry and various offices in the area, depending on where we place you for your externship. One thing that you need to know about this is you need your own reliable transportation to get to these externship sites. The good thing about the program is that we have a nice transition from your didactic courses going into labs where you will practice everything you learned in your didactic courses. You will practice on each other. And then from there, the second 8 weeks of that first semester, you're going to go to Loma Linda University, do some rotations there where you will be working with dental students, and the dental students are also students as well. They're learning. So it's a nice transition into a slower pace where you're both learning together. And then from there in the spring, you will go into your externship sites. And this is where it's more like the real world. You're going to be in an actual dental office assisting at a faster pace. So you get that nice transition from a little slower pace to now the real world before you go into your jobs after you graduate. And then graduation, upon graduation, you will get a certificate. And then you can also apply for your AA if you have all your prereqs done for your AA.
And if you have questions about your additional prerequisites for an associate's degree in dental assisting, we highly recommend that you meet with a counselor. In fact, everybody should meet with a counselor to discuss any questions that they might have with regards to their academic plan, and just to make sure that you have a clear understanding of what needs to happen to achieve your goal, your academic goal. With regards to the prerequisites, you must be a student at the Moreno Valley College. You need to make your Moreno Valley College your home college. So if your home college is Norco or Riverside, you need to make sure that you make MVC your home college in order to be able to register for the classes in the program once you're admitted. You also must take the assessment test and test into English 1A without the accompanying guidance course. You must have a high school diploma or equivalent or higher, and you need to include a copy of that in your application. And you also need to have your CPR card, and it has to be very specific. Please take notes on this. It has to be the CPR card provided by either the American Heart Association or American Red Cross. It needs to be the hands-on course. It cannot be the online course. And it has to be the course for healthcare providers. And it needs to be the BLS, the Basic Life Support course. So make sure that the course that you choose to take, and you can Google the courses and find out what courses are offered in the area. This is not a semester-long course. This is a one-day course. It usually takes about 4 hours. The initial one is probably a little bit longer, but it's between 4 and 6 hours. And if you have any questions about the acceptability of a course that you intend to take, please email us the information and we'll confirm that that is an acceptable course. So this is something that you take in one day. It's not a semester-long course. Again, if you have any questions about that, please feel free to send us an email. So the process for the application, we're currently accepting applications. They're fillable online. You can submit your paperwork online with the exception, so you can put a copy of your CPR and attach it. You can also send it through the mail and we'll get it. So just make sure you follow the instructions on the applications and include everything that you need to include. At this point, I believe Natalie Valcarcel was able to join us. And I will let her introduce herself, and she comes just in time. This is the process and the information that you need to submit with your application is her area of expertise. So I will let her introduce herself and take it from here.
Okay, once all the applications are processed, after applying to the program after the deadline, you will receive a letter letting you know what your status is in the program. You will have attached to this letter a few things. The first thing you will see is a health vaccination and physical exam form that you will be taking to health services, or our student health services here at the Moreno Valley College. And you will need to make sure you take any vaccination records that you have to the student health services so that they can verify whether you are immune to the diseases or not. Also attached to this letter, you will have a flyer letting you know of the mandatory orientation you will need to attend. And that orientation is mandatory. You do have to come to this. If you are not able to make it, you will forfeit your space in the program. At that mandatory orientation, you will be given instructions on a background test that you will be needing to take. You will have not only the background check, but a drug test as well.
And we did mention that in a previous slide, so they're a little bit familiar with this requirement.
Okay.
Yes. Also, just important to remember that all the instructions will be in that letter, outlined step by step. Important to remember not to take the TB test too early. It has to be taken within a certain time frame that it will be mentioned in the letter. So it's important to follow the instructions very carefully. And we're always available for questions. So if you have any questions about that, we will be available. Regarding the mandatory orientation session, really quickly, I want to mention that this is usually held about a couple of weeks prior to beginning of the school year, and that way it gives you time to prepare. We'll give you your schedules at that time, your books, and other important information, and you will have those 2 weeks prior to the beginning of the school to prepare for the program. Okay, so these are some suggestions for the courses that might help you in preparing for the program. These are not prerequisites, you don't need to take them. It's important that you are familiar with the computer. All of our classes are web enhanced. We have a couple of classes that are hybrids. Part of the didactic portion is taught online. All of our quizzes and exams are online, so it's important that you're comfortable with the computers. If you're looking for an additional class to take to prepare you for the program, an anatomy class or a health class or a medical terminology class would be beneficial because it will help you familiarize yourself with the medical terms that you will need to learn while you're in the program, medical and dental terms. So that would be beneficial. The program is 1 academic year in length. We start during the last week in August. We accept up to 24 students each year. Classes begin in August and at the end of August. And we do have classes during the winter intersession. You are taking 3 classes in the winter intersession. And you are taking a full-time load in the spring semester, and students graduate in early June. More information on the classes that you need to take, you will find in the information flyer that is linked on our website. So feel free to take a look at that, download it, print it for your records if you want. If you have any questions about the classes, feel free to email us. One additional thing I would like to add with regards to the classes is that the classes must be taken in the order in which they are mentioned in the information session, in the information flyer. They're only offered once a year and they need to be taken in that particular order, since information learned in one class pertains to the subsequent classes. And every class must be passed with a C or better in order to proceed or advance in the course. We discussed the clinical rotations at Loma Linda University and general offices in the area. If you have any questions about the externship rotations, again, please send us a quick email. Other than that, I would just add that the fact that we place the students in a minimum of 2 offices allows the students to have a very well-rounded experience in clinic, and allows them to figure out while they're in the program what kind of setting they would like to practice in. Would they like to practice in a bigger clinic or in a smaller clinic in a certain specialty? So this gives them a well-rounded experience. But again, it's important that students have reliable transportation to be able to go to those rotations. Expenses for the program, Natalie, would you like to discuss?
Sure. This is just a breakdown of what it could cost to be in the program. These prices can vary, and they're only estimates, but you have an idea, a little bit of an idea of what it would cost to be in the program so that you can prepare and be ready to pay for these things. You will need to have at least 1 set of black scrubs. You will need to buy books and supplies. Also, you have to take into consideration the health exam and immunizations that will need to be taken so that you can be prepared to pay whatever fees are involved with that. There is a health service fee of $18 that you need to be prepared for. Also, for tuition, it's $46 a unit, and you pay as you go. You don't pay everything all at once, so this way you can prepare for each semester. Parking is $50 a semester, and any additional campus fees, you need to be prepared for that. So make sure you set aside any money that you may feel that it would cost.
And just a quick note on that, we encourage all the interested students to schedule an appointment with financial aid to apply for financial aid as soon as possible. I know that FAFSA comes out January 1st. If you haven't applied for it this year, make sure you go and apply. A lot of our students qualify for a BOG waiver, a tuition waiver, so make sure you apply for all the financial aid that you can. Schedule an online appointment with our financial aid office, and they will be happy to assist you with what you need to know. And just for reference, the total number of units in our program is 32.5 units. And again, this the tuition money will be paid as you take those courses. So if you take 14 units in the fall, you will pay for 14 units in the fall, unless your financial aid covers it. Many of our students qualify for the financial aid, and that would cover the books and supplies. And we always try to work with the publisher so that the books, so they get our students a really good discount on the books that they need to purchase. We put all the books in a package. The publisher usually gives our students a discount on the books purchase. These again are estimates like Natalie just mentioned, but we wanted you to have a general idea of what the expenses will be for the dental assisting program. So that concludes our presentation. If you have any questions, please feel free to email us and or call us, and we will be happy to address your questions. Thank you for joining us today in this virtual meeting, and we're looking forward to meeting you in person and reviewing your application. We're hoping you apply.
Bye.